All right. So our topic is going to be about tennis elbow. And I'm going to start with the introduction. So tennis elbow is like an inflammation or like a micro tearing of tendons in the forearm. And it usually affects the extensor muscles, especially the extensor carpi radialis brevis muscle and the extensor digitorum. And then the symptoms include pain over the lateral epicondyle of the humerus, especially with gripping, and activities that require wrist stability, such as backhand stroking in tennis, and like repetitive work tasks that require a lot of like repetitive wrist extension, such as doing computer work or like pulling weeds, can stress the muscle and the tendon and can cause that symptoms. And the positive test include tenderness of lateral epicondyle with palpation, pain with resisted wrist extension with elbow extended, and then pain with resisted middle finger extension and pain with passive wrist flexion and elbow extended and forearm pronated. And then
so there are various impairments and limitations that are caused with this. So extensive activity of the wrist and the hand will lead to this gradually increasing pain in the elbow region. Whenever there's also involved muscle stretching or contraction against resistance, this will also result in pain in the elbow area. Many people experience decreased grip strength because of that pain, and they will also experience decreased muscle strength and endurance. Another impairment would be proximal weakness of the shoulder and scapular musculature, as well as decreased mobility of lower cervical and upper thoracic spine, as well as tenderness, which kind of goes along with that pain over the lateral or medial epicondyle. Limitations that go along with this are any provoking activities like racket sports, throwing, or as it's commonly known as tennis elbow, so tennis. Also repetitive tasks that irritate the forearm or the wrist, which would be using a keyboard or a mouse, or certain gripping activities, using a hammer, anything like that.
For the prognosis, the condition is most prevalent between people of the age of 45 to 65. However, it's rare in those over the age of 65, regardless of treatment at all. So that speaks to the prognosis of the conservative treatment, because a lot of those people didn't treat or get surgical procedure done at all. Patients between the ages of 33 and 55 present with symptoms of tennis elbow when they go to the doctor for something different than tennis elbow. So there's also a lot of people that don't go to the doctor for their tennis elbow, which, speaks to the severity of the condition. And one of the most interesting points was that the half-life of tennis elbow, according to this one study, was only 3 to 4 months. So in 3 to 4 months, 50% of people healed their tennis elbow with no treatment. And then in an additional 4 months, of those 50% that were untreated, another half, so 25% healed. So very few people after 1 year of no treatment still have symptoms, something like 10 to 15%. One study that was conducted, it was only 26 people, so it's a little underpowered, but half received surgery and half received a sham surgery. So they basically just got a cut and got stitched back up, and no one knew who got surgery and who didn't. And there was no significant difference in the recovery between the 26 people. So based on the studies that I looked at, conservative treatment is the preferred method of treatment over surgery.
So for treatments, there were a couple of studies that we looked at. The first one was between therapeutic ultrasound and extracorporeal shockwave therapy. So the parameters for ultrasound, it was 1 centimeter squared head, 1 megahertz frequency in continuous mode, 5 minutes a day for 5 days a week, and 10 sessions in total. The extracorporeal shockwave therapy was 10 to 15 hertz, 1.5 to 2.5 bar density, 2,000 pulses, and 1 time a week for a total of 3 times. And both of them showed significant improvements in the VAS scale, in an algometer, a dynamometer for strength test, and PRTEE, which is patient rated tennis elbow evaluation. But there was no significant difference between the groups, except for the algometer scores. They were better with extracorporeal shockwave. And the next study was between exercises and extracorporeal shockwave. So in this one, there were 50 patients, 25 of them had the extracorporeal shockwave. It was once a week with 1.8 bar pneumatic pressure, 10 hertz frequency, and 2,000 pulses. And exercises, they did 3 times a week for 3 weeks, and it was mainly dealing with isometrics and eccentric exercises in the elbow. And both showed significant improvement in the VAS scale, again in the PRTEE, and grip strength with the dynamometer. And there was no significant difference between the 2 groups.
Okay, so a couple outcome measures that can be used for lateral epicondylitis or tennis elbow would be the patient-rated tennis elbow evaluation, which is just a 15-item patient-reported outcome measure. It looks at 2 different subscales, pain and function. So this is something that the patient would fill out, and that way the therapist can look and see where the patient thinks they are functionally and with their pain levels. The next one is going to be the pain-free grip test, which is a physical performance measure or a patient performance measure that requires a handheld dynamometer. With lateral epicondylitis, patients typically have issues with grip strength. So this PPM records grip score at the onset of pain, and this will allow the therapist to kind of record and show progress with their grip strength as the patient is going through their interventions. Finally, the patient-specific functional scale is another patient-reported outcome measure that can be used. This scale doesn't necessarily directly correlate with lateral epicondylitis, but it's a really good way for a therapist to be able to see where their patient is functionally with their desired activities. So very specific to the patient's goals and tasks of importance to them. And that really allows for the therapist to be able to track progress as they're going through their therapy.
Thank you.